Hi everyone, I'm going to discuss about the posterior or hamstring compartment of the thigh from this video. The posterior compartment of the thigh, also known as the hamstring compartment, this extends from the buttock or gluteal region to the back of the knee. The posterior compartment is separated from the anterior compartment by the lateral intermuscular septum. These are the anterior compartment muscles, which are vastus, and these are the posterior compartment muscles. We have semimembranosus, semitendinosus, and biceps femoris. So you can clearly see the lateral intermuscular septum. But can you see a clear intermuscular septum separates this adductor compartment or medial compartment from the posterior compartment? No, there is no clear septum dividing the posterior compartment from the medial or adductor compartment. Instead, the adductor magnus has origin from the hamstring compartment as well. Cutaneous nerves supply mainly from the posterior cutaneous nerve of the thigh, and this nerve leaves the pelvis through the greater sciatic foramen below the piriformis, and in gluteal region it located deep to gluteus maximus and on the sciatic nerve. When the nerve ran down, it located deep to the fascia lata, and this nerve separated from the sciatic nerve by the long head of biceps. Then it pierces the fascia lata at the back of the knee joint and supplies the skin up to middle of the back of the calf. And also the posterior aspect of the thigh getting nerve supply from the cutaneous branches of the obturator nerve as well as the medial branches of anterior cutaneous nerve. And also lateral aspect supplied by the lateral cutaneous nerve of the thigh. So in hamstring compartment, we have three main muscles. We have semimembranosus, semitendinosus, and biceps femoris. This muscle biceps femoris has two heads, long head and the short head. So all hamstring muscles origin from the ischial tuberosity medially and laterally and are inserted into the tibia and the fibula. So these muscles in the hamstring compartment span both the hip joint and the knee joint. The short head of biceps femoris origin from the back of the femur. We'll talk about these three muscles individually so you can have a good idea. First one we are going to talk is semimembranosus. So this muscle origin in the lateral part of the ischial tuberosity. If we look at the ischial tuberosity, we can identify there are two regions laterally where the semimembranosus origins and the medially where the biceps and semitendinosus origins. So from this lateral aspect, the semimembranosus origins. It origins as a long flat tendon and towards the middle of the thigh, muscle fibers commences and inserts into the medial aspect of the tibial condyle. So from this insertion, there are three expansions diverge. So you might see this picture blurred, sorry for that. So one diversion passes forward along the medial surface of the tibial condyle deep to the tibial collateral ligament. This one highlighted in the green. And the second expansion, which is the oblique popliteal ligament, passes obliquely upward to lateral femoral condyle. The third one covers the popliteus muscle and reaches the soleal line of tibia. So semimembranosus muscle is supplied by the tibial part of the sciatic nerve. So you know this muscle expands from the hip joint to the knee joint and inserts on the back of the tibial condyle. When you think about the origin and insertion, actually you can work out the action. It do hip extension and knee flexion and medial rotation of the leg when knee is flexed. Next muscle is the semitendinosus. It also originates from the ischial tuberosity, medial aspect of that, and it inserts onto the upper medial shaft of the tibia, posterior aspect. And this muscle also covers the hip joint and knee joint, so it too extends hip joint and flexes knee joint, as well as the semimembranosus. It also medially rotates the leg when knee joint is flexed. Next muscle is biceps femoris. So it has two heads, long head and short head. Long head originates from the ischial tuberosity medial aspect along with the semitendinosus and passes downwards and laterally, crossing the sciatic nerve. The sciatic nerve located beneath this muscle and joined with the short head. Short head origin from the whole length of linea aspera and upper part of the lateral supracondylar line of femur. So the biceps femoris tendon inserts into the head of the fibula. So you can see in this muscle only the long head covers the hip joint but not the short head. Combinedly, this muscle extends hip joint by the long head and flexes the knee joint and rotates the leg laterally when knee flexed. So short head does not act on hip joint, only act on the knee joint. So the blood supply of the hamstrings to the upper part of the posterior aspect of the thigh, there is a contribution from the inferior gluteal artery and the lower part from the popliteal artery. The main blood supply derived from the profunda femoris artery and its perforating branches. This perforating branches pierces the adductor magnus and at the back of the thigh, it makes a series of anastomosis. So the perforating branches of the profunda femoris supply hamstrings and overlying fat and skin. Nerve supply. So actually I have mentioned only the nerve supply to the semimembranosus in earlier slides. So to the semimembranosus, semitendinosus and long head of biceps femoris is supplied by the tibial component of the sciatic nerve. And to the short head of biceps, the nerve supply is from the common peroneal or fibular part of the sciatic nerve. I think now you have an overall idea about the posterior compartment of the thigh. As a summary, if we recall, posterior compartment of the thigh located between the gluteal region and the knee joint, and the main cutaneous nerve supply from the posterior cutaneous nerve of the thigh, and then it has three main muscles: semimembranosus, semitendinosus and biceps. Biceps has long head and short head. So the all muscles except the short head of biceps femoris spans through the hip joint and the knee joint. So the all three muscles extend hip joint and flexes knee joint except the short head of biceps, and semitendinosus and semimembranosus medially rotate the flexed leg, and the biceps femoris lateral rotates the flexed leg. Blood supply is derived mainly from the profunda femoris artery contributed by the popliteal and inferior gluteal arteries. Then the nerve supply from the sciatic nerve, its tibial and peroneal components. Thank you very much and have a good day. Stay tuned with Anatomy Everywhere YouTube channel.